All right. Good evening, everyone. I'm Dr. Jaspreet Singh, and thanks again for joining us for another session here. Celebration of Men's Health for Movember. Today's topic, we're going to be talking about testosterone deficiency and its relationship not only with sexual health, but just overall well-being of being a man. Fairly common topic. I have many patients every day coming in, either to be tested for testosterone issues or even uh, getting it treated. So let's get started here. For those of you who are not familiar with who I am, I'm Dr. Jaspreet Singh. I'm a board certified urologist. I did my residency and fellowship in Philadelphia, Pennsylvania, and was on staff at Thomas Jefferson University Hospital for a few years before moving back to where I grew up in the Hudson Valley, and I joined Premier Medical Group now about 13, 14 years ago. My main office is out of New Windsor, New York, and the number to the office is 845-437-5000. And so, for those of who are new to the webinar, this forum, we've had other discussions this month, and those can be easily accessed through the same registration that landed you with this meeting through the website at premiermedicalhv.com, where you can catch the other topics that we had already discussed this month, including testicular cancer and here we go, including testicular cancer and prostate cancer. All right, so let's talk about testosterone deficiency. Well, the term testosterone is describing the male sex hormone. It is the most important male sex hormone that us men have. Uh, Testosterone itself helps the body produce and maintain adult male features. Obviously, that is experienced through a boy going through puberty, such as deepening of the voice, facial hair, etc. Low levels of testosterone affect man's sexual drive, what we call libido, certain physical features, and mood. The uh, overall interest that men have in engaging in sexual activity is primarily driven by testosterone. And when that gets affected, uh, can affect a man's desire to engage in sexual activity. Rough estimate of how many men are facing testosterone deficiency. We're estimating that roughly 5 million men in the United States have low testosterone, and I think that's an underreported number, as a lot of men do not come to discuss these issues with their doctors and often will claim or try to justify that they are all part of an aging process rather than an underlying medical pathological problem. And what we'll finish the talk with is to understand how we can fix low testosterone and what options are available to us. So, as I mentioned, low testosterone and sexual health can include a decreased sex drive or libido, can also eventually affect the health of the erections. Erectile quality, whether it's a partial erection or lack of erections, can be evident. And sometimes men will even say that erectile function as they're sleeping or when they're waking up in the morning, the spontaneity of those erections disappears. Also, what low testosterone can affect is the fertility issues and the lower sperm count. Now, excuse me, how does low testosterone affect erectile dysfunction? Well, I think a major play in this is the lack of desire. So men who present with not only difficulty achieving spontaneous erections with sexual activity, but complaining that there is a lack of desire often leads us to screen and check for low testosterone. Now, does all ED mean low testosterone? It does not. There's various other reasons for erectile dysfunction. There are diseases of the nerves and blood vessels that affect circulation in inhibiting the ability to achieve a full erection. And what are some of these issues? Well, cardiovascular health is important. Somebody who has heart problems or perhaps vascular issues, um, history of a stroke, things like that, can affect the circulation of blood into the penis. And so men will often report soft erections and uh, erections that are not rigid enough for penetration. Nerves, the pelvic nerves are also important. These nerves send a signal for the blood vessels to dilate, and that dilation is what allows increased blood flow into the penis to engorge the penis. What happens with nerve damage, which is typically seen in men who have had their prostates removed or radiated, that can result is the lack of signal for these blood vessels to dilate, hence resulting in similar issue where the penis cannot engorge. And here's a quick diagram for us to understand what that means. The normal penis in a flaccid state has spongy tissue which is not engorged. When a man is excited, aroused, those nerves get excited, sending a signal for the arteries to relax and dilate. As you see on the right side of this diagram here, the spongy tissue is engorged, allowing an erect state. Now, just to be complete, so that we all understand the basic physiology of a good erection, uh, yes, blood flow is important, but at the same time, there's certain veins that are constantly draining the penis, and these veins need to be able to close or shut down to essentially trap the blood within the penis. These veins can be damaged. It's something we call corporal-venous occlusive disease, and often is an issue for men who don't respond to oral medications or other medical intervention for erectile dysfunction. And then also, men who have low testosterone may not have difficulty with erectile dysfunction. Um, they'll often report that, Doc, I have no issues. I'm with my partner, I can get an erection, but I just do not have any desire to do so. And that usually can also happen where one is struggling with low testosterone, but without erectile dysfunction. Now, what are the testosterone's normal effect on the body? Well, we can break this down based on the different parts of the body here. So when it comes to the central nervous system, low testosterone affects the brain. We talked about libido, but also testosterone is important for having some aggression type behavior, and also is important for cognition, meaning it allows better concentration and better ability to understand and pick up things. Testosterone's effect on the skin, it helps with male pattern body and facial hair. Also, the conversion of testosterone in certain men who are predisposed to male pattern baldness also can is primarily driven by testosterone production. Also is important in the skin for sweat production. Within the kidneys, even though most people recognize that red blood cells are made in the bone marrow, that stimulation occurs from the kidneys. So testosterone has an important effect in signaling appropriate red blood cell production. Testosterone is important at increasing muscle mass and decreasing fat mass. That balance is important. And as far as its effect on sexual organs, as we talked about um, with puberty, we have penile growth, prostate growth and function is also important, and sperm production. Um, and then what's also often forgotten, chronic low testosterone can result in early osteoporosis, as very similar to our female counterparts who are postmenopausal are at an increased risk for osteoporosis. So are men who have low testosterone. It causes early osteoporosis. So bone health, bone strength is dictated and dependent on testosterone. And so when these things get altered, one can understand that there are certain symptoms that go along with low testosterone. And the degree of deficiency uh, uh, is correlated with the symptoms. And so mild low testosterone, as you see in this chart here, can affect libido, vitality, fatigue. I often will have men who complain that they wake up feeling tired, or perhaps in the middle of the afternoon have to pursue taking a nap to recharge. As the degree of testosterone deficiency increases, so can the degree of symptoms here, eventually leading to anemia, erectile dysfunction, loss of muscle mass, testicular atrophy, weakness, bone loss, and loss of facial, axillary, and pubic hair. Now, why would low testosterone occur? Well, to understand why low testosterone would occur, one needs to understand that testosterone primarily is made in the testis. So any disease of the testis can affect appropriate testosterone production, and things like chronic testicular infections, testicular trauma, perhaps removal of the testis for testicular cancer. So all these things can affect the factories that make testosterone. Um, Chronic illnesses, critical illnesses, all affect testosterone production. Increased level of stress. There was a study that was published a few years ago that looked at testosterone level in men whose wives were pregnant. Interestingly enough, as their wives were pregnant, it definitely affected testosterone level in men. Uh, Perhaps related to stress, don't know, but it was a very interesting observation study that was published. As I mentioned, testicular trauma, obviously, with resulting in the damage to the testicles. There's a whole slew of genetic and metabolic disorders that can affect testosterone production. Klinefelter's is a big one. But these are often picked up earlier in life, where boys may have delayed puberty, on exam may have issues with small testis or micropenis. So these often get picked up by the pediatrician. As I mentioned, chronic illnesses, which we often forget about, things like diabetes, chronic renal failure, HIV. In fact, 30% of men who have HIV have low testosterone, COPD, other lung issues like obstructive sleep apnea can also lead to a low testosterone level states. There's also certain medications, corticosteroids inhibit production of testosterone, and then chronic opiate use. I have many patients that uh, were on that are taking chronic opioids for chronic pain management, or in the past were unfortunately addicted to opioids. Often are struggling with low testosterone. So as you can see, there's a whole slew of reasons why testosterone could be low, and it doesn't necessarily mean that it's part of the normal aging process. Although we recognize as men get older, typically testosterone level does decline, but we'll get into what defines low testosterone, and then more importantly, how to treat it. And there's certain conditions that uh, are important to also note that can lead to less available testosterone. Testosterone itself is a hormone that is typically bound to several proteins, more specifically to albumin and sex hormone binding globulin. And what happens to testosterone when we check it through blood work, we often, as clinicians and patients who have their testosterone checked, will have something called a total testosterone level checked, and which can be misleading. One can have potentially quote unquote normal total testosterone level, but the available, what we call bioavailable or free testosterone levels may be low, and these are often seen in patients who are obese. Testosterone often gets metabolized to estrogen. Fat cells are aromatizing. What they do is they take testosterone that's available, convert it into estrogen, and so it's a double whammy. One, your testosterone levels low, and two, your estradiol, estrogen levels are elevated in the obese state. So obesity is um, a risk factor where, obviously one has to try to better manage to increase our own endogenous testosterone production. Now, how do we diagnose testosterone deficiency? We'll go into signs and symptoms of androgen deficiency. We'll also discuss what normal testosterone levels are. That often is a debate that we have in the office. So symptoms, as briefly mentioned already, because we discussed what normal testosterone does. Low testosterone levels can result in reduced energy, a decreased sense of well-being. It's almost like men will say that they don't have that pep in the step. They're often lagging behind, whether it be at work or taking care of household activities. Fatigue is also commonly is a common complaint. We talked about testosterone and its effect on libido and ED, changes in ejaculation, the strength decreases, lean body mass also decreases with increase in central obesity, fat deposition, and then loss of height and body hair. Um, One of the earlier symptoms can include irritable mood, lethargy, lack of motivation. Low mental energy is also important. The acumen, the desire to learn, concentrate gets affected. And, a lot of these symptoms are very uh, slow evolving and also not like very, widely felt. Of course, there's many reasons to feel tired. All of us work hard, maybe don't sleep well at night. So there's various reasons to have these symptoms, and often men will blame those other reasons rather than getting themselves checked out with their doctor for their testosterone level. Um, when testosterone levels are really severely low, hot flashes can be felt, sweating, anxiety, those type of symptoms. And so, how do we diagnose men with testosterone deficiency? The easiest way is to check blood work. And there's many different methods to check, and I wanted to take a second to just describe what I feel is the kind of the gold standard is something that's called mass spectrometry. It's the use of liquid chromatography. Often, if you look at your blood work report, when I order blood work, I order testosterone, which will say total testosterone LC/MS, and that's what that is. I think that's the best way to check total testosterone is a mass spectrometry. It's the best way to uh, 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 check testosterone levels. There's various other assays. These can vary laboratory to laboratory. Men who have borderline testosterone levels will often not get their testosterone levels checked via MS, liquid. Sometimes diagnosed. I have seen labs that range from lower end of 200 all the way up to 1,000. So um, that's one of the challenges in treating testosterone deficiencies that, what is the right number for an individual may not be the same number for another person, and the range is so wide that it does become difficult. And we don't really check testosterone levels when things are normal and healthy. And so can become a challenge for clinicians and frustrating for patients. But aside from which blood work to order, it's very important that the testosterone level should be checked early in the morning for men who are, sleep at night and are up during the daytime. Ideal time is to be checked before 10 a.m. There's variations, something called the circadian rhythm that we see here in this chart. And you see on the bottom is the time of day and the testosterone level on the left side. So early in the day, the testosterone level is at its highest level as expected because the body is getting ready for the day. There's a testosterone surge between the hours of early hours of 4 to 7 o'clock in the morning in preparation for the individual to get ready for the daily routine. And then throughout the day, as you can see, the testosterone level will decline. Most of us will prepare for bed between 10 to 12 o'clock at night, and as we're resting, testosterone level will then rise. So it's very important that is recognized and the blood work should be checked. Now, I have patients who have a flip schedule where they're working during the nighttime and awake during sleep during the daytime, awake and working during the nighttime. We have to flip that chart. So I usually encourage to get blood work a couple hours after getting up. Okay. So in general, any patient whose testosterone level is less than 300 would consisting less than 300 would definitely meet the criteria for being diagnosed with testosterone deficiency. So this is a good general kind of guideline, and obviously this can be tweaked patient to patient and clinician to clinician. But in general, we all recognize that testosterone levels that are consistently above 350, the likelihood of you having the diagnosis of testosterone deficiency is low. And most of us will not treat men whose testosterone levels are greater than 350. If the serum testosterone falls between 250 to 350, the testosterone level should be repeated again. Again, a morning one should be done. And then men who have low testosterone, less than 250, are most likely to be hypogonadal and will meet the criteria for treatment. And of course, we want to make sure that we're not missing any other reasons for low testosterone. Um, Very rarely, I've diagnosed men with pituitary tumors, and so brain tumors, pituitary tumors, to be exact, can often influence testosterone levels. So that's something that is one of the differential in us clinicians trying to understand why the testosterone level is low. All right. Now, as far as management goes, we'll finish the talk here on management. And so, who may not be, who should avoid, rather, this title of this slide should say who should not be a good candidate for testosterone replacement. Any men who have a history of prostate cancer, um, or, uh, an untreated prostate cancer or suspected prostate cancer, should not be given testosterone replacement therapy. Um, it's important to note that testosterone replacement does not cause prostate cancer. There's plenty of literature supporting that. And also, with appropriate counseling under the guidance of um, a physician, that men who have had prostate cancer and treated successfully without any concern of prostate cancer can be, in the select patient, candidates for testosterone replacement. So typically men whose PSA level is greater than 4, um, or have a family history of prostate cancer with a PSA level of 3, I would want to investigate that first to make sure that there is no concern of prostate cancer before starting them on testosterone replacement. Men who already have issues with prostate enlargement. As we discussed, testosterone is important in influencing prostatic growth, benign prostatic growth. And so men who already have severe urinary symptoms should be cautious, perhaps treat those BPH symptoms before getting on testosterone replacement therapy. Breast cancer, history of liver cancer, anybody whose blood count is elevated already. This is often seen in men who have COPD, may have high red blood cell count to begin with, should be cautious. Anybody who has heart failure and untreated sleep apnea, because all these conditions can worsen with testosterone replacement therapy. What are our treatment options? Well, in general, the most common in the United States are transdermal, whether they're creams, gels, or patches. Those tend to be the most common prescribed. Various reasons for that. They're easy to get. A lot of them are generic. They're easy to use. They're done daily. The downsides are that about 20 to 30% of men who use transdermal therapy will not have appropriate absorption through the skin, and the testosterone levels will remain subtherapeutic. Now, of course, how do we know that? Testosterone replacement needs close monitoring with blood work. So men will come back to the office in a few months to have their blood work checked to make sure that the testosterone levels are responding and therapeutic on treatment. There's certain downsides to transdermal application. One, it does require compliance, that it requires a daily application. Number two, men who may have younger children, or grandkids, or partners, you have to be careful because some of the gel that's still residual on the skin can be transmitted with close contact to somebody who shouldn't be getting it. And so that often is something that men need to be counseled on. Um, One way to circumvent that is using a patch. But again, there's no free lunch. Patches are often associated with skin irritation. In fact, 1 out of 3 men report skin irritation from the glue that's used for the patches. Less likely than some of the gels and creams, lower incidence of skin irritation, but that can also happen with transdermal application. Oral pills are typically frowned upon. Testosterone replacement in an oral pill can cause liver damage. There are certain formulations now that are available in the United States that what the way that these medicines work is they bypass the liver metabolism. These pills often have to be taken twice a day and with some sort of a meal to keep that absorption in the gut and not through the liver. It can be an annoyance due to compliance of taking it a couple of times a day, and how you take it can be challenging. One of my most common ways I inject is through injections. There's two kinds. There's muscular injections and subcutaneous. I prefer subcutaneous injections. Several reasons for this. One, it's relatively painless. Number two, it's easy to use. It just goes right into the belly fat. Number three, there's no concern of any transference. Because it's going under the skin, there's no concern that you're going to spread it to your partner or kids. It's effective, unlike the 30% failure rate of gels. Because this medicine is going under the skin, testosterone level is going to respond. And the formulation that comes in the sub-Q dose I like, as it limits the variability. That's one of the downsides to testosterone replacement, that men, as they get the medication, they report really a good high for a couple of days and then a crash because the lifespan on the muscular injections is not as long as the subcutaneous. Um, and some of the side effects, like the increased risk of red blood cell production, is lower with subcutaneous injection. Alternatively, muscular injections are typically self-administered, usually in the lateral thigh muscle, or if you have a spouse that can inject it, maybe in the gluteal region. And this again is usually at least once a week, sometimes twice a week, depending on how the patients are metabolizing the medication. These tend to be a little bit more painful because the needle is slightly bigger than the subcutaneous ones. They're not pre-mixed, unlike the subcutaneous ones. These are medications that you have to pull through a vial. So you have to be comfortable with managing drawing up medication and needles and so forth. But again, highly effective. Will result in a good response with therapeutic testosterone levels. And then for men who are looking for more long-term options, is something called testosterone pellets. These are done in the urologist office, a little tiny poke in the side, either in the flank region, the love handles, or the upper buttock region. After anesthetizing the skin, it's a procedure that takes maybe about 90 seconds. And these little pellets are placed under the skin into the fat. These absorb over a period of time. The absorption is slow, typically will last for up to 3 months. And so it avoids any sort of weekly or daily application of medication, gives a sustained release over the course of the 3 months. The downsides are that, you have to come to the office, a little bit of soreness with putting these pellets under the skin, risk of bruising and that kind of stuff. But for many of our patients that are more on a long-term regimen, we'll opt for the testosterone pellets. Now, what are the benefits of each achieving optimal testosterone? And I think that word optimal is important. Not necessarily more is better. Higher testosterone levels can have certain downsides as well. One, after a certain point, when your body doesn't need testosterone, it'll get converted to estrogen. So there's certain downsides to having high estrogen levels. So optimal testosterone, for me, for most men who need treatment, who are starting with numbers less than 300, try to get them at a range at about 4 to 500, somewhere in that realm. But once a good steady state and optimal testosterone level is achieved, you can see that there are definitely certain advantages symptom-wise that should improve. Now, of course, the cartoon is a bit of an exaggeration. We're not looking every man to become a Superman, but the things that we're looking for is a better mindset, better confidence, overall happy uh, mental health well-being over a period of time, strong bones, having energy levels, keeping up with daily activities. So very important to recognize the benefits of replacing testosterone. Now, with everything, there's of course side effects, and this is why testosterone replacement needs to be managed with your medical doctor. Um, some primary care providers are comfortable managing it. Some patients will see an endocrinologist, but as urologists, we're more than comfortable in treating men and diagnosing and treating men with low testosterone. So, certain potential side effects before we start testosterone replacement is a discussion with patients that it can cause an increased red blood cell count. This occurs depending on what type of medication you're using. Higher incidence of this with use of intramuscular injections with specifically testosterone cypionate um, can cause polycythemia. Um, Now, how do we manage that? Well, of course, we need to monitor it, and if the testosterone levels are elevated, we often encourage patients to donate blood, and which is a nice, healthy way for both the community and the patient to manage a high red blood cell count. And if not donating blood, patients can go to the lab and get their blood drawn out. Um, Testosterone replacement should be uh, cautiously given in men who are looking to have kids. The testosterone replacement can lower FSH levels, and FSH is a trigger, a hormone that helps sperm count production. So one has to be counseled appropriately that if you're looking to have kids, testosterone replacement may not be the right time, as can decrease sperm production. Testicular shrinkage and atrophy can occur because testosterone replacement signals your own body to shut down the signals for testicular growth. And we can circumvent this. In some patients, we use HCG. HCG helps preserve sperm production and testicular size. Certain side effects to testosterone replacement therapy, although a lot of these are low, edema or fluid retention, increased body hair. For some men, that can be annoying. More robust hair growth, injection site reactions, of course, pain, discomfort from where you're injecting. Initially, I typically see this, which kind of settles in, but I have had a few patients that have been bothered by skin changes, whether that be acne, oily skin can happen. As we discussed earlier, testosterone is important for the sebaceous glands, the skin sweat glands. Um, Increased risk of aggressive behavior. Uh, I've had one or two patients who requested to stop testosterone replacement therapy. They felt, or they reported that their partners felt that the patients were resulting in aggressive behavior. Breast enlargement in a select few could be a side effect, and then urination changes has to do a lot with benign prostatic growth. And again, this doesn't happen overnight. Prostatic growth happens over a period of months to, if not years, and so that's something to monitor for. So that concludes our seminar on testosterone deficiency. Um, Hope that you all learned something here, and at least bring to awareness the importance of not belittling kind of some of these symptoms that we discussed. Um, and if there's any concerns, would like to explore this more, I'm more than happy to see you in the office. Once again, my information is up here uh, on the screen. The phone number to the office is 845-437-5000. And once again, the address to the office is 955 Little Britain Road in New Windsor, New York. Thank you, and enjoy the rest of the day.